Okay, so this part of the lecture is the part that's the actual lab practical. So this is the stuff you're going to have to know for the lab practical along with those specific bones. So the shoulder joint is a ball and socket joint. All right, so it's a ball and socket joint. You should understand things like, understand things like the head of the humerus fits into that glenoid cavity of the scapula. You have the shoulder joint is a relatively loose joint capsule because of the structure. And think about how much movement you have at your shoulder, where you can move your shoulder almost in any direction. And because of that, that's why we need a loose joint capsule. There are bursa in the shoulder joint. So say right here, there's that bursa. You don't have to know the specific name of the bursa. Okay, but that bursa can become inflamed with overuse. Let's see, the articular cartilage on the ends of the bones can wear down. There are lots of ligaments with the shoulder joint, and those ligaments prevent the shoulder joint from becoming dislocated. Okay, so let's look at some of those ligaments. We have the coracohumeral ligament, so from the coracoid process to the humerus, transverse humeral ligament, and you can't see these ones because they're hidden in here, but under the capsule, but you have the glenohumeral ligaments. Oh, here they are in this picture. Okay, so from the glenoid cavity to the humerus, surrounding glenoid cavity. The shoulder joint is protected by a set of muscles called your rotator cuff muscles. Okay, rotator cuff muscles. Those muscles we'll talk about in the next unit. Elbow joint. Elbow joint is a hinge joint. Okay. The trochlea of the humerus fits into the trochlear notch of the ulna. Okay, and this is that olecranon process is your elbow. That's what you feel, that part you hit that hurts. Okay. There's also within here a gliding joint between the capitulum of the humerus. So there's a gliding joint in the capitulum of the humerus and the head of the radius. Okay, and we can't see that from this angle. Does flexion and extension. We don't have a lot of hyperextension normally with the elbow, unless you're messing with like Steven Seagal, then you could have it. And there's a lot of ligaments in here also. See those ligaments. It's a relatively stable joint. So ulnar collateral ligament, radiocollateral ligament, annular ligament goes around, annular ligament goes around the joint to hold it in place. Okay, hip joint is a relatively complex one. It is also a ball and socket joint, but think about how much movement you have with your hip, and it's not nearly as much with the shoulder. That's because the capsule is a little deeper there. So hip joint, you got the head of the femur fitting into the acetabulum. It is a deep joint capsule. A lot of ligaments with the hip joint, and obviously, like we said, less movement. Okay, so with the head of the femur fitting in there, Here are some of the ligaments. Iliofemoral ligament, so from the ilium to the femur, and this one goes down to the lesser trochanter. Oh, and you can see it wrapped here. What else? Pubofemoral ligament, femur to the pubis bone. Ischiofemoral ligament also wraps ischium to femur. Okay, knee joint is the largest joint we have in our body. It is definitely the most complex joint in the body. And you have medial and lateral condyles of the femur are articulating with the medial and lateral condyles of the proximal tibia. Okay, and the femur also articulates anteriorly with that patella. It is a modified hinge joint. You get flexion, extension, and very little rotation in here. You get a lot of ligaments and a lot of tendons. If you think about injuries you hear with sports people, it's usually a knee joint injury. And you have menisci here as padding, and you've got bursa where tendons slide over. Tendons slide over the joint. Okay, let's just look at some of these ligaments. We're definitely not going to be able to see all of them. So the main ones that we hear about are ACL, the anterior cruciate ligament, which attaches to the anterior portion of the tibia. There's also a posterior cruciate ligament, which is going to be behind that one. So it attaches just behind it. We've got the menisci. So you hear about people who have a meniscus tear in their knee, and that's here. Sometimes that meniscus gets scraped to get rid of it because it's so damaged. Okay, so those are the different joints. And you're definitely going to want to know those, just the general structures of them, the names of the ligaments, what kind of joint they are, what kind of movement they allow, those types of things for the lab practical.